Doctor, can we start?
Yes, sir. Yes. And first of all, thank you to you and your coaching center for providing a platform for us, super specialty post PG, sir. It was a very good experience. Actually, I joined the speed 2020 Jan February in the face-to-face classes. I came to Chennai. Actually, I am from Telangana, Hyderabad, near Hyderabad. It was a very good, sir, experience. And thanks a lot for every faculty and especially you, sir, for along with the teaching, you also fill the student with confidence that you have no fear. But both studies and both management tips.
Great,
Sorry,
Doctor.
sir, my English is not so much fluent, but I will try to do as much as possible, sir.
So, to Dr. Pranay Kumar, I bring in all the wishes and greetings from Speed Institute on behalf of all the faculties of Speed Institute to you for scoring a topmost rank in NEET SS 2021 session in the specialty of MCH Surgical Oncology, rank number 7.
Okay, sir. Thank you, and thank you to every faculty member and also the other office bearers of the speed. They also cooperated very much during the coaching.
Doctor, can we know from you? Thank you, Doctor. I will convey your regards to all the faculty members and the entire team. Can we know from you about a brief background from where you come from, Telangana, and where you did your medicine, where you did your MS, and why do you want to do surgical oncology?
Sir, I am from a rural background, sir. I am belong to a small village named district headquarters Adilabad, which is in Telangana, near Hyderabad. I did my MBBS from Gandhi Medical College, Secunderabad, sir. And after that, I completed my MS General Surgery from PGI Chandigarh, sir. And while doing that PGI surgical residency, in our surgery, as it is a tertiary center in the Chandigarh and surrounding Punjab, most of the general surgery cases were related to cancers, tumors. They are liver tumors, GIT tumors, sarcomas, everything. There is no specific department of surgical oncology, but general surgery used to do the surgical onco cases of general. So, on seeing the cases, I felt that the surgical cancer cases are increasing in our country. The burden of cancer is increasing day by day. So, and it is a fascinating subject. The cancer staging and also treatment. But if we detect early, with stage 1, stage 2, we can prolong quality of life very much increase within the patient. So, by it include multifactorial, but educating the patient, screening, and also the surgeries. Basically, on seeing the cases, very much workload of the cases, I'm deviated to surgical oncology. It is a fascinating branch to me as a personally. To keep on growing like.
Great, great. So it was a beautiful journey, starting from a small village from Telangana and then going on to Hyderabad to Gandhi Medical College, from there to going on to PGA Chandigarh. And now the journey continues, and we'll see the climax where it's going to go on for super specialty. Now, what are you planning to choose? This MCH surgical oncology, which
Actually, I am very much interested in doing in Tata Memorial, Mumbai.
Mumbai.
My aim was in Tata Memorial only, sir. Actually, I've been preparing for 2 years strictly. Last year, my health didn't cooperate. Just before exam, 1 month I got dengue fever, so I couldn't revise, so I couldn't get the seats. But your speed materials were very much helpful to revision and doing MCQs, everything.
So we want to know your methodology of preparation. How did you prepare? When you start? Where you started? And how many hours you dedicated for this? We want to know those details.
Yes, sir. Super specialty. I know that surgical oncology is competition is very high. After surgical gastro, I observed as surgical onco as a second competitive branch compared to the seats. So I had two choices: doing work and spending at least 2 to 3 hours per day, and other is completely on the study. But because of the competition, I thought even the 1 2 MCQs, positive, negative also, the rank will be very much fast. So I focused totally on. But I didn't do any work, sir. I daily 10 to 12 hours reading totally, and I planned such that daily I have to solve at least 100 to 200 MCQs. So that daily one paper I used to create myself in an exam setting and spend a 1 to 2 hours as a paper, and daily I used to solve minimum 100 MCQs, 200 MCQs. And the mistakes I made, I used to recall, and 2 3 times revision and revision. The MCQs are the most my preparation background, sir. On the MCQs and with the explanation, I used to do the theory and videos. Generally, it requires 6 months. But I felt that the pattern, the present NEET SS pattern, at least the 6 months preparation, 6 to 4 months preparation is necessary. If they are doing any job, then 1 year preparation with 2 to 3 hours per day. But completely study 6 months, but 10 to 12 hours per day. That also MCQs, and if possible, the coaching centers. We have to take help from that.
Yes, I was asking you the live classes. Were you attending live classes?
Yes, sir. Your class was amazing, sir. And especially Dr. Karthikeyan, sir, Dr. Ravi Shankar, sir, classes were too good. With their explanations, point to point, their explanation, and the MCQs, and the MCQs explanations were very good, sir. From that, the basics we learned, from that basics, if somebody attended your classes, then they will get almost compulsory, sir.
Great. And how many questions did you attend?
Sir, out of 100, I attended 98 questions, sir. General
Super.
surgery, 39 I attended. And surgical onco, 59 I attended, sir.
Super. And this paper had a lot of pediatric surgery questions. The general surgery this time had a lot of pediatric surgery. I don't know.
Sir, in surgical oncology, we have general surgery, ENT, ortho, and OBG. 4, sir.
So it was spaced.
Yes, sir. So pediatric surgery, personally, I felt when compared to other general surgery paper, general surgery, pediatric surgery, little less in surgical onco basics, because the ENT and ortho, OBG also included portions, at least 10 each subjects, sir.
Great, really superb, really nice talking to you. I'm feeling very happy and excited to talk to you. And I also want to know from you, what is the message that you want to give to all your juniors, your friends who are aspiring for MCH, SS, and also for surgical oncology?
Yes, sir. First, you decide the branch very carefully. Don't go to the branch by saying that somebody is told it. You work in the department, and if you are interested, then first is that one, sir. Second, it is better if you dedicate completely like 10 to 12 hours per day. If you have, if financially you are good, then at least dedicate 3 to 4 months to the exam, because competition is very much tough. But if you think that by doing work and 2 3 hours reading within 1 to 2 months, it is enough. It is not enough, sir. As I learned from that. But attend the speed coaching is, of course, I will recommend everyone to attend speed coaching. In their crash course within 10 days, within a gap of 1 week, 10 days, they will teach you everything from general surgery and all specialties. The live course was very much helpful, 90% helpful to me. And if you are doing the work kind of study, at least 1 year preparation is necessary. If you are doing completely 10 to 12 hours reading, 3 months is okay, sir. And when they are preparing, prepare as if first MCQs give preference. MCQs and answers, at least daily 100 to 200 MCQs, and explanations, whether they may got mistakes, doing grand test or mock test, as much as reading theory is another level, but doing MCQs, their deduction capability, elimination capability, they will increase, sir. So doing MCQs are the most important. Second, attending coaching, sir, your class especially, because from this pattern only general surgery is there, sir. From this year they changed the pattern to general surgery only. So your classes will be the basic.
Thank you, doctor, for good words. And I wish you once again all the very best and all the success as a great surgical oncologist in years to come. And you will rock and you will really do wonders. I know that. And because you have that mindset, come on, let's go and do it. That kind of a mindset you have. And definitely you will give a chance
Thank you very, very much to you, especially, and all the faculties and all the staff in the speech, sir. Again and again.
Thank you, doctor. And I wish you all the best and all the success to you, to all your family members, friends, and relatives.
Okay, sir. Thank you, sir. Thank you, sir.